But what I heard today mostly was that in order to provide optimal care to our patients, we need to put them at the center of the problem. Even though we still need to do differentiated service delivery. There's a need to find synergies between HIV and tuberculosis programs, models in which specific multidisciplinary teams should target specific goals and challenges. We also need new regimens that intend to facilitate community adherence to TB guidelines and simplify preventive tuberculosis therapy with minimal adverse reactions and drug-to-drug interactions. And we have seen some examples today, just as what Dr. Chason and also with the new long-acting agents. At the same time, with the use of basic science and new technologies, we may have in the near future better vaccines that either prevent or really treat tuberculosis, especially non-active tuberculosis. We also learned about the efforts in other high-risk populations, children, pregnant women, MDR patients, and models of support to scale up tuberculosis preventive therapy, so that tuberculosis preventive therapy should become standard of care, and this should provide better ways of evaluating all TB and HIV programs. At the same time, we need to do public health policies that can really get feedback from the people, as well as accountability by people and by the governments. TBPT should not wait for tests, and it seems that the best timing to start therapy should be when antiretroviral therapy is started. At the same time, we need to diminish cost and produce effective and better barriers and elude and keep out barriers to use these new drugs, and they should be eradicated. And at the very last, in our panel, we saw how community systems and promotion of community-led differentiated services models for HIV and comorbidities should be strengthened through the support of treatment advocacy groups. I think that what I learned the most is that we need an effort from everybody so that we could really get tuberculosis under control at the same time as HIV is and has been for the last 25 years in a fight against people that are dying out of this. I want to express my deepest congratulations to two people. I hope that you can accompany me, because all of us that are over here, we get all applauses. And, but the unsung heroes are the ones that should be applauded for. So I want to take 30 seconds of your time to say that Lucia Gonzalez and Lotte Van Giesenwyk did a great job. It's been a job for about a year, and nobody applauds them, and I think that this is the time to do so. Many, many thanks.
The role of the HIV community contributing to decrease the burden of TB infection. I say it's the role of the TB and the HIV community. And so he's going to be talking to us about the call to action.
Oh yeah, thank you, Paula. Well, I think the instructions I received was that I should talk on behalf of all the participants here and basically pronounce what we as a community and all the participants of the meeting here, what we agree to and that we agree that we will advocate for. So I'm going to read the 5 points, action points of the call to action that comes out of this meeting. And I will speak on behalf of everybody, so it's a pleasure and an honor to do this. We call upon all the UN member states, organizations of the UN system, intergovernmental and non-governmental organizations, the corporate sector, foundations, donors, national governments, and the international community to promote enabling environments that reduce the burden of TB among people living with HIV by scaling up TB treatment and prevention. Therefore, we advance the following 5 actions that stakeholders can undertake in order to eliminate TB in people living with HIV. Firstly, sustain the necessary funding for both TB and HIV by increasing the momentum of TB and HIV response, by urging leadership for from political, religious and civil society leaders at all levels to approach expenditure in health as an investment that will generate value to their societies and economies, not just as an expense. Secondly, to galvanize stakeholders at all levels to ensure access to TB and HIV services and models of care that have the affected individuals and communities at their core. So by prioritizing multi-stakeholder and coordinated TB and HIV responses as the driver for a reformed public health paradigm, implementing evidence-based interventions, rolling out prevention services and consolidating health services towards universal health coverage. Together with HIV treatment, preventative treatment therapy can reduce the risk of TB disease in people living with HIV by up to 90%. Thirdly, accelerate R&D of technology innovations, including diagnosis, treatment, and vaccines. We must dedicate resources, with all high burden and G20 countries investing a proportion of their gross domestic expenditure, which will expedite efforts in the research and development of new technologies. This will also rapidly increase the uptake of new tools to prevent and treat TB and HIV. Fourthly, to decrease the burden of combined HIV and TB stigma, ensuring that national programs strike a balance between a standardized public health response and innovative solutions to better support the realities of the communities and the individuals affected by TB/HIV. We must honor the rights of people living with HIV and affected by TB and decrease gender-related barriers. Stigma and discrimination will go a long way to decrease the vulnerability to TB and HIV in all societies. And I would like to make a quick reference to the Declaration of the Rights of People Affected by TB, which was published in May this year by TB People, Stop TB Partnership and USAID. And then lastly, to commit to outstanding programmatic performance. So striving for quality and implementing initiatives that are routinely geared, also monitored and evaluated towards reaching TB and HIV targets at the country, regional and global levels, including through and especially through accountability frameworks. Thank you.
Thank you very much. So now, to provide us our final remarks of this productive meeting, I have the pleasure to invite Professor Anton Pozniak, the current IAS president. And Anton is a consultant physician and senior lecturer at Chelsea and Westminster Hospital, where he is the executive director of HIV research and the director of HIV and head of the tuberculosis services. Please.
Thank you very much, and thanks for staying. I won't keep you too long, it's just a few remarks. So, the IS has always been proud of being a force to help convene and bring people together. So I'd like to thank the partnership that we've made with Stop TB and USAID to make this conference happen. And my thanks to the co-chairs, Beatrice and Alfredo, for organizing this with their committee and having a meeting actually on TB prevention. And what we really need to do now is to make everyone aware that TB prevention's moved into a new era. In 2000, I remember people meeting and saying it's impossible to give ARVs to everyone in the world. It's not going to happen. But leadership and advocacy has proven that wrong, and it really needs to be proven wrong in terms of TB preventive therapy. And we've got lots of lessons we can learn from HIV, and I've heard a lot about integrating HIV and TB. We should be together. There should be no separation in that term. So the new drugs, I mean, you know, it's been fantastic, some of the developments with short course and new drugs, but we need low price. People say, how are companies going to invest in that? Well, talk to generics. They may. If they can make a penny on every pill, they will invest in it. We need easy registration. And so some of the lessons we've had from the HIV world in getting drugs fast-tracked and registered, we should use those mechanisms to make sure that we can get registration for new drugs in TB. After all, they're saving lives, and people shouldn't wait. In fact, there's already, and in our project in Tanzania, we're going to start to use a combination of cotrimoxazole with isoniazid, with pyridoxine, and it's all in one pill. Already around, but if you look at the world, how many people are using that for simplicity, it's a very small number. So we have to continue pressurizing to achieve our development and production of new drugs and make them available. But I did hear, I think, a big major message from the meeting that I've been for this, just the afternoon part, was the call for TB and HIV integration. And no antiretroviral therapy without TB prevention shouldn't be just a mantra. It should become a reality. And we've got guidance, we've got a roadmap, but it really needs implementing. And things like the differentiated service delivery model that we're using for HIV is an example of how we should just say it's not just for HIV. It's, we're going to use it for diabetes, we're going to use it for hypertension. Why aren't we using it to deliver TB prevention? So the other thing, universal health coverage. It's universal, and the problem is that it doesn't appear so when you look at incarcerated people, if you look at migrants and other key populations. And the right to health needs to be on every government's agenda as non-negotiable. And the thing is, we vote these governments in, well, in most countries we do, and we must lobby our parliamentarians, we must make sure that we always lobby the governments to say that, I'm sorry, healthcare, universal health coverage is non-negotiable, and tuberculosis prevention is part of that. Literacy is crucial. We have to increase the demand for literacy and reduce stigma and discrimination. Now, healthcare workers themselves discriminate against people with HIV. There's lots of work around that. They discriminate against people with tuberculosis. They don't want to start TB preventive therapy because, oh, he might have TB, he might then develop TB, he might then develop resistance. I don't want to go there. So we really need to increase the demand and the quality of our literacy. And finally, I can't really leave the podium without mentioning money and investment. So there's a 7 billion gap between resources and need. We're going to have replenishment of the Global Fund. Since 2010, investment in HIV has gone down. And when I say investment in HIV, most of it's been bilateral, so it's also investment in tuberculosis. And we really need enough money to fill the gap. And I don't see why, when we talk about funding for HIV, part of that is tuberculosis preventative therapy. And as I heard earlier, you can't have one without the other. So in the end, I think that this conference has made an impact, and I think that the discussion amongst you, the thoughts that I've heard, I hope will motivate you and move you forward to greater and better things, that the science will prove that we can do it and it will be done, and that we don't wait and wait and wait and wait until we end up with something that is not controllable. The time's now, and we can take it. Thank you.